Hello wonderful people, it's Dr. Sil here. This is a reflective video because I have just finished my first term as a junior doctor. And as you might know, my first term was in mental health rehabilitation. A very interesting first term to have actually. Compared to other medical or surgical terms, the pace of mental health rehabilitation is much lower. People aren't acutely sick and dying. Most people actually in physical, health-wise at least, are stable and they're there to improve their mental health so that they can improve their function and become meaningful members of society and have fulfilling lives. Which kind of means that I'm seeing all the happy stories of mental health. The people coming in who are severely disabled because of their mental illness, and throughout a long admission, usually 3 months, sometimes 6 months or even years, they are gaining the skills and independence and optimizing their medications such that they can do things that they never could do before. And in fact, my term was 10 weeks and I had someone come in from my first week and I got to see them go from week 1 to 10, and it's a totally different person, which is one of the most beautiful things about mental health. You can really change people for the better. So when this person came in, they were spending 90% of their life in their bedroom. They had really active auditory hallucinations, saying absolutely awful things about them and their parents. But now on the right medicine and the right supports, including psychology and group therapy, he's an avid painter and the auditory hallucinations and paranoid delusions have all been significantly reduced. He's going super well and will be discharged back to home soon. He's got lots of new social supports and friends. So that was just like a really nice case example of someone going from a really bad place to a pretty bloody good place. In terms of what it's been like as a junior doctor, doing the mental health rehabilitation term as the first term I think was a good thing, but there are pros and cons. Because it's less acute illness type presentations, I haven't learnt a lot of the important medical things that you need to learn as a junior doctor. I think I will still learn them throughout the year, but I might make mistakes later in the year that, if it's your first term, people are okay with you making silly mistakes. As you go through the year, people have higher expectations of interns. And so I might not have had the opportunity to make the silly mistakes that other interns in more medical or relief after hours type terms have made. But I was really happy with this being my first term because it meant that I could have that really scary learning curve of internship at a bit of a slower pace. But all in all, I'm very happy that I had mental health rehab as my first term. It actually has been quite an independent term because I've had some consultants that have been away and some registrars that have been away, and so I've had to make quite a lot of independent decisions and kind of upskill in that area. And a lot of the other staff, like the nursing staff, have appreciated my work ethic. And after working for about 10 weeks, I think I can say that I'm a hard worker. I really like to get stuff done. I don't want to put stuff off. And that kind of attitude goes a long way in the healthcare system, which is a very chaotic with kind of not that much oversight. So you can get away with being lazy. Some people do. And it's good to have the GSD gene, get shit done gene. On my last day, I had a lot of sad goodbyes, and funnily enough, and I think this is the first time that someone has kind of recognized me from this channel, nursing student recognized me from the cannulation video that I did on how to cannulate, where originally I was meant to show on my friend, but he didn't turn up because he was sick, and I ended up having to cannulate myself for a video, which, I don't know, I promise I don't have any kind of masochistic ideals or behavioral traits, but anyway, she was just like, "Oh, you're Mr. Cannulation." I was like, what? Anyway, it fully made me blush, and then she told everyone on the ward that I have a YouTube channel, which I haven't told many people about. By the way, if you ever see me out, please feel free to come say hi and make me blush. Totally fine with that. I've also received some nice thank you letters from patients. One from a Chinese patient's mum, and she called me Meslin of Sunshine. She goes, "Thank you, Meslin of Sunshine. She said, one day you'll make a great doctor." And I was like, oh, all right. Anyway, I see the point. But maybe she thinks I'm a medical student or something, which says a lot about what I'm doing in the ward, I guess. And I'm excited for the next steps. So next term will be trauma surgery. So trauma surgery is a pretty interesting surgical term. It's either very chilled or very hectic. And I don't think there's much in the middle. That's kind of what I've been told. Because if there are no traumas, things are pretty stable. And then if something goes down, all hands on deck. Interestingly enough, a lot of trauma surgery is mental health involved because a lot of the patients might have mental health issues and have had failed suicide attempts, and that's why they're coming in. So that can be very interesting, and maybe I'll be involved with a lot of psychiatric liaison. So at this point in life, I'm very keen on starting psychiatry training probably next year. But I really want to have some more time to make online courses that educate around mental health issues. And I also think that it might be beneficial to have an online course about how to get into medicine, because that's an area that doesn't have like a good course. The issues are time, and I'm actually currently thinking about going part-time next year. Just a thought. But if you'd like to see an online course, leave a comment down below saying whether you'd like a course on a mental illness education, maybe depression, what you can do about it, or maybe would you like a course on how to get into medicine, or a course on how to survive internship, all those kind of things I'm interested in playing around with. So if you have an interest, definitely comment down below. I'd really appreciate that. That's it for this little reflective video. Thanks for listening. I really appreciate it. I wish you all the best. And if you want to support my channel, you can leave this video a like, you could tell your friends, you could subscribe, you could do all those wonderful things to help me out. I've started hitting another phase of growth on YouTube, which is very exciting to me because I haven't been doing this seriously, but now I think I might start getting into it a bit, because I usually had like 1 subscriber a day previously, and now I'm hitting like sometimes up to 10, which I'm sure to big YouTubers is nothing, but to me that's absolutely fantastic. Anyway, please support the channel. I really appreciate it, and I'll see you guys in the next video. Have an absolutely lovely day. Bye for now.